This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the Ph.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch. Every Sunday, 8 till 9, right here on Talk Radio 1210 WPH.D. I'm John DeMasi with the one and only Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We will talk about the who, what, when, where, why, and how of Innovative Medical Associates, as we do every week, so that you can understand what Dr. Molly does and how it can help you. We call that improving your overall quality of life. Dr. Molly is available if you want to talk to her on the phone. If you have a question or a medical challenge, 855-839-1210, 855-839-1210 is the number here in the studio. At any time during the course of the show, if you have a question or a comment, feel free to call in at 855-839-1210. And as always, Dr. Molly, it's a good day to get healthy.
It is, John, it is. And it's a beautiful day. Thank goodness.
Yes. What do you actually do? Can you
That's a hard question, right? One of the things I want to say is that Innovative Medical Associates is actually a group of like-minded healthcare providers who all operate out of my clinical setting. We are a licensed primary care facility in the state of New Jersey. And so we actually all feel the same way in terms of what we do for people's health. And in that regard, I want to say that we're a little different than most primary care facilities because we also believe in God's ingredients and utilization of natural substances to help a patient get through their healthcare challenge and not put them at risk medically. So I'm a lucky woman in that all the providers share that philosophy. And the way that we do this is we use hydration therapy as one of the vehicles by which we're able to use these natural substances. Now, these are substances, John, that you can actually go to the health food store and get. But what are you getting? There it is.
Well, that's not exactly true because you don't get what you give.
Exactly.
So explain that, what you get in the health food store and what you do.
Right. Well, one of the things you're going to get in the health food store is you're going to see aisles and aisles of supplements, and you may run into someone who's quite knowledgeable and put you in the right direction, or you may not. But the question is, are you getting the therapeutic level of a particular nutraceutical's constituent that will effectuate the change for you and possibly help you reduce your pharmaceuticals to a point where we can stop some of the side effects, not just from your condition, okay, by using these natural substances, which in many times happens, but to actually help you get off of some of the pharmaceuticals or reduce the amounts you need to take. And this is really where we focus.
Now, are there side effects with the natural products?
Sure, there can be. And you and I both know that, having gone into health food stores and picked something up off the shelf.
Yeah.
And again, there's different quality in terms of the health food store. And one of the things I'm going to tell people, and certainly today, less and less really great quality products are out there because more and more pharmaceutical companies are jumping into the game. And so somehow the standards of the old, as I like to say, tried and true manufacturing companies out there has gone by the wayside because, you know, it's just the way it is. Everything is geared up right now.
You know, you always talk about getting advice before you go to the health food store.
Oh, boy.
You had a patient a couple of weeks ago, and she showed me a picture of her cabinet.
That patient's in the chair, right?
Yeah.
Oh, my goodness.
And she was like, "Oh, I don't take them all every day." I said, "Oh, I hope not." I mean, there had to be 50 or more.
And therein lies the rub, John, because what happens is many times you're canceling out some of the other, you're taking some, canceling out others, and many times you're replicating what you need by having all of this grouping that probably is not really doing you any good.
Your whole philosophy, though, is wrapped around hydration.
Yes.
And explain why you choose hydration.
First of all, it's the most direct vehicle to get the particular constituent, and in particular the substance, the constituent of the particular God's given ingredient, especially natural substances. Getting enough of it in, getting it just right for the patient and the patient's problem, and getting it directly and bypassing the digestive tract, which makes you lose somewhere between who knows what, 10 to 100% of the bioavailability of a particular substance.
Many people ask you, and I'll ask you because it's really an important part of this, does the hydration work?
Medical hydration definitely works. And how do I know that? I can both show you qualitative data. When people come into me, you think I have the kind of clinic I have if people aren't doing well? You can't.
No.
They'll come and beat you up, John.
Yeah.
Okay?
That's
so
true.
so the deal is when you come in, they all miss you,
Yeah.
When you're not there, they miss you, and they all want to know, well, where's John? How's John doing? And the bottom line is John's doing well. And the reason being is that I believe we do it well, and our proprietary blends, I also believe, have a lot to do with it.
And those proprietary blends come from?
God's ingredients. I'm a big believer in using natural substances. The body has an innate ability. Now, this is a belief. If you're going to beat me up, all you scientists and physicians out there, I'm ready for you. But my belief is that the body has an innate ability to differentiate between many of the manufactured stuff and the extracts from natural stuff. And for that, I give my compounding pharmacists a lot of credit, and I use several of them. And they're excellent, and they really make the products for our particular facility.
Those compounding pharmacists, though, are really directed by you.
Oh, yes. Oh, yes.
So those are your proprietary blends.
Yes, absolutely.
So
absolutely.
they can't get them anywhere else.
No, the proprietary nature of the IVs. I mean, you can get vitamin C IV anywhere. Go to the spa. You want ascorbic acid is ascorbic acid. My extracts are pretty interesting, and my combinations are the key to what we do.
Now, you probably can tell us, but could you give us an idea of how your blends are different?
Well, they're extracted from all natural substances. I pretty much don't use any manufactured material. Now, sometimes I have to use a man-made amino acid. For example, in our cardiac protocol, we have to use EDTA. That's man-made. But when I go to the second half of my cardiac protocol, I'm using extracts that are cardiac nutrition, and that is from natural substances. And therein lies the difference. It's how you put things together.
And
synergies.
You have studied the synergy of these different blends.
Yes.
And really that's the perfection of this, correct?
I would say that's true, John. I would
Yes.
say that's true.
So that really it's not just a blend. You're getting something
it's
unique.
it's the synergies of what we put together and the uniqueness of the protocol. So, for example, as I said, we'll use the man-made amino acid. We have to. That's what claws out the calcification or the free-floating calcification that actually causes plaquing. But what do we do to strengthen the heart muscle? So there is complexity to our protocol.
All right, we're coming up on our first break of the morning. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. I'm your host, John DeMasi. We are both coming back. Dr. Molly and I return. 855-839-1210 is the number here in the studio, 855-839-1210. You want to call early, get in your question or your thought for Dr. Molly, feel free to do that, 855-839-1210. We are both coming back. More Health Watch after these words. Hi, I'm John DeMasi, host of Health Watch, Sundays on Talk Radio 1210 WPHT. If you or someone you know is battling cancer, long COVID, or an autoimmune condition, medical hydration therapy may help to reduce chronic symptoms like pain and fatigue, so you or your loved one can live a better life. Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates have helped thousands of patients to improve their quality of life. They prescribe and deliver vitamins, minerals, and medications directly into the bloodstream where they can best impact your overall well-being.
We can bring a patient to a better quality of life and then a healthier approach to their entire condition.
Tune in to Health Watch Sundays at 8 a.m. and 4 p.m. to ask questions and learn more about the benefits of medical hydration therapy. Visit innovativemedicalassociates.com to schedule your free in-office consultation with Dr. Molly Fantasia today. We are back here on Health Watch. Operators standing by at Innovative Medical Associates, 856-489-0505, 856-489-0505. When you call, you want more information, fine. But really, the most important thing is that you book your appointment for the free initial consultation with Dr. Molly, and that's where you can really get your questions answered, and you can really find out what this thing is all about. 856-489-0505, Innovative Medical Associates, Marlton, New Jersey, and of course the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210. If you have a question or a thought for Dr. Molly, you want to call in early because we can be sure that we can get your call and take the time that we need to go over your situation. 855-839-1210 is the number here in the studio. There is a new Alzheimer's test, Dr. Molly.
We talked about it last week. And
they must have been listening. The FDA
was
listening.
No. This is in the past month. The FDA's been very busy in many, many instances. They've just approved, actually, and I think a lot has to do with their recent approval of the amyloid test. And so they've just approved a new drug for Alzheimer's disease, and it's available like now. It's pretty expensive. And I got to tell you, I have an interest in these neurodegenerative diseases. You know that. And we have several patients who have them. The other thing is, I read an interesting article that spoke, and it was in Neurology Today, which is a publication for neurologists, okay, that showed that the number of patients living with Parkinson's disease, so also another neurodegenerative disease, is far higher than the original 650,000 in the old model. Do you believe that, John?
Yeah, that's
so why, why the sharp increase in these types of conditions? Now, we know the amyloid, is an inflammatory condition for Alzheimer's. So obviously it would be beneficial to people to really put themselves on an anti-inflammatory diet, including some things. And one of the things that we know helps in the amyloid condition is what else that I use in our clinic? Vitamin D. Vitamin D for the amyloids in Alzheimer's. And it really helps with the cognitive issues and the impairment issues and the dementia as well, because it's actually a hormone. It's a neurostimulating hormone that regulates neurotransmitters, etc. So the idea is we actually use vitamin D in many of our protocols. You know that, John.
Yes.
And we use it in particular natural oils. For example, we can use it in cottonseed oil. We can use it in olive oil. So there are so many ways to utilize vitamin C. But one of the things I want to say is I want people to come in ahead of time. That's why I talked about the amyloid testing last week. Early intervention is probably better than late treatment.
With everything,
Right,
really.
right. And the other thing I want to talk about is why the increase in Alzheimer's-like syndromes. Well, people are saying in the conventional wisdom is, well, it's probably related genetically. And you know how I feel about genetics. Just because we have the gene for one thing doesn't mean we have to express it, right?
Right.
But, okay, we should be aware of it. But there are some other reasons. For example, I believe a lot of this has to do with a couple of things in the rise in the sedentary lifestyles. There's not enough exposure to exercise. How about environmental risks, John? Do you not think our environmental risks are up in this world?
Oh, yeah, absolutely.
You better believe it. And I can tell you, there was a little blurb in this particular publication I read that said they believe that a decline in smoking actually was one of the reasons why Parkinson's is elevated. Well, I'm going to tell you, okay, you know what? If that is true, okay, that's a short answer. I don't believe it's the one. But you know what I think? I think it's better that we see the decline in smoking for the environmental toxins rather than just the problem with cutting out the smoking. And in particular, this past week with that big train derailment and that kind of thing, I had patients coming in asking me, are we being exposed? Well, I don't know that yet. But I would imagine the winds are taking them to everywhere.
Sure.
And I tell you, if you have a Parkinson's-like syndrome or you have a Parkinson's actual diagnosis, I'm treating one of my physician's brothers who's doing very, very well, and several other patients. Are we curing Parkinson's? No. Are we reducing the tremors? Yes. And we're doing this by using a form of regenerative medicine.
I want to get back to this Alzheimer's and the FDA-approved test.
Yeah.
Is there a chance that we're making progress with Alzheimer's? Is this test a breakthrough, can you say?
Yeah, I would say it's breakthrough. As a matter of fact, I took the test myself because I was worrying that, although I don't have Alzheimer's in the family, I think every once in a while my staff is telling me I'm having a senior moment. So I started to think, and I took the test to see. I wanted to really understand the methodology, et cetera. I love the test. It's done. It's a cover test, by the way. It's done in a traditional laboratory, one we can send right out to, and your primary care doctor can send out for it and should send out for it.
We have a call. We're going to go to the phones. We have George in Bryn Mawr. George, good morning.
Hi,
You're on
George.
Health Watch with Dr. Molly.
Hey, George. How are you?
Hi.
Hey.
I'm doing okay. You were just speaking about environmental factors.
Yes.
I have what some people call environmental illness or chemical sensitivity.
God bless you, George. What a cross to bear. Go ahead.
And it came on when I was working at a job that had a leaky building.
Oh,
and
my
mold.
goodness. Yes.
Mold.
Yes. Yes.
It gave me tremendous sensitivity to perfumes and cleaners and stuff. Plus, I developed a pretty strong electrical sensitivity.
Really? Woo.
Computers, cell phones, yeah.
Yes. Yes.
So I wanted to ask about what you think about that.
Well, I think it's absolutely true. I think that if people poo-poo that, they're not thinking straight. Look around. I actually have a woman right now that we're treating who had a tremendous exposure to a mold. And I can tell you that she's really showing signs, and she's pretty far along, actually, of ALS, which we know is a terrible condition. And again, I believe that her family's doing everything she can for her, including what we're doing and using a neurodegenerative protocol through hydration. But, George, you've got yourself quite a problem because now I would imagine any small amount of exposure sets your whole body into a challenge, I would think. So I got to tell you, I believe it. I've seen it, and I know that lots of conventional people don't believe it, but I think they're missing the boat. And I think mold is much more rampant than we know, and sick building syndrome is definitely around, especially in New Jersey.
Well, he's in Bryn Mawr, so.
Well, yeah, he's in PA, but I'm saying my clinic,
Yeah,
especially in
absolutely.
Jersey, I'm seeing it.
Oh, yes.
So, George, God bless and good luck with that. And I'm sure you're taking some natural remedies now, right?
Yeah, and they help. Yeah.
Good. Thank
Thank you.
God. Thank you.
Thanks for the
Thanks,
call,
George.
George.
That's a great call.
Is that really a problem? I mean, it's
Yeah.
It seems like it's bigger than what they're letting on.
Yeah,
to be.
I would tell you that absolutely. You know, I am a member of the environmental group, the environmental medicine group, and we've seen more and more of this. And if you go back a while to Schumacher's work about 15 years ago, he was on it ahead of everybody, saying that the environmental issues are tremendously important and cause all kinds of syndrome-like situation where people can mimic these other conditions, whether it's Alzheimer's or Parkinson's or ALS, this kind of thing, and sometimes MS. So the question is, you know, what comes first, the chicken or the egg? You know, but I can tell you that the natural substances, and in particular my MS protocol, has helped many people in that regard. But again, when they're so super sensitive, it's a real problem about where they get treated.
I know you have protocols for this.
Yeah.
Is it a good idea that people who think that they're involved in suffering from this, should they come in?
Well, I think that they certainly can come in, but I think you see how George is saying that he already put himself on a more natural. They really should seek out people who are in functional medicine, whether it's me or other people.
Okay, we are coming up on our halfway point of the show, and we're going to get into a lot more of this neurodegenerative, Parkinson's, dementia, that kind of thing. We're going to get into more of that. Dr. Molly has plenty to talk about with that. 855-839-1210 is our number here in the studio. 855-839-1210. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, that number here in the studio, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return. More Health Watch after these words. Operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. 856-489-0505. You want to call and make that appointment with Dr. Molly. It's the initial consultation is complimentary, and you'll really find out how she can help you and why she can help you. That's really the important thing as far as your condition is concerned. 856-489-0505. And don't forget the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that as well. Check it out, and it's updated every week, 856-489-0505, and innovativemedicalassociates.com is the website. You'll check that out as well. If you want to call in right now, Dr. Molly is here, 855-839-1210 here on Health Watch, 855-839-1210. We're going to wrap this up. You do have a number of patients living with Parkinson's.
I do.
And one of them in particular is, Rich. We know him very well.
Yeah, Rich is a great guy.
And he's a great guy, and he's a former engineer.
Yeah.
Who still
radio
dabbles.
guy. Radio guy.
Still dabbles.
Right.
But understand he's in somewhat of pain.
Well, he has a very interesting thing because I believe, well, first of all, he definitely has a bona fide diagnosis of Parkinson's. And, of course, they went to a very large facility. They made the diagnosis, and he's on Parkinson's meds. Let me reassure people that we're not telling people to throw away their medication. But he also sat in my chair. And one of the things that I would say is, and actually he called the show to say that while he was doing the Parkinson's protocol, he found that he was able to rethink some of his earlier symptoms and really said, you know what, some of them had dissipated and he was feeling a little better. in terms of the neurodegenerative. Unfortunately, he has a mess with his lumbar. He was born with scoliosis, and of course, as you get a little older, that gets worse. And he really has problems with facets, and he has joint problems, etc. But I want to tell people, here's a reason why we do what we do. The last couple of weeks, I've been treating his pain and sending him to a colleague of ours who has a pain management group. He couldn't get in anywhere. We went the extra mile, and I was able to get him in to a friend of our clinic who is an excellent, excellent pain management group. And they're getting him in, and they're actually going to give him some facet shots, etc. But my point is, you don't always just have one condition. But don't you think that a pain condition would exacerbate his Parkinson's condition? Sure. Or did his Parkinson's exacerbate his pain? I would say his pain condition right now is the primary focus of what we're all doing. But I got to say that he had improvement from his Parkinson's based on earlier IV treatments that we were able to give him.
And you're often looking at what can reduce neurodegenerative
Absolutely,
diseases.
Absolutely. And I'm going to say it again. Get in earlier. Anti-inflammatories are extremely important. And there are many that can help in this thing. Just as the simple thing like vitamin D. We know it.
What is the prognosis for Rich?
Rich is going to be just fine. He's in great hands with the pain management people that we know and that understand what we do, and between what we're going to do for his pain management with the natural substances and the anti-inflammatories. And by the way, many of the anti-inflammatories that we're using for his pain overlap for the neurodegenerative fire. So, there's going to be a good outcome with this. He's got to get out of the acute situation.
By the way, I visited that pain management
thanks
specialist.
To us.
Thanks to you.
Yeah.
And he helped.
I know.
So,
and this is what we know. Listen, I don't send anybody to any place that I wouldn't go to.
Right.
And that's real.
And I should tell you that you have a network.
Oh, I do. Of natural,
yes.
of natural as well as conventional
yes.
specialists who've toured our clinic and know what we do. They don't want to talk about it. I have a retired doc right now. He talks about a lot. He goes out and talks about it to his oncologist, right?
Yes.
Which causes him a lot of agita, as they say in our vernacular. So I love him, Bo. I love him.
Yeah. 855-839-1210 is the number here again, 855-839-1210. You have an interesting case.
Yes.
I know you wanted to talk about this woman with burning bladder. And,
right. It's called IC, yeah.
This is complicated.
It's a little complicated, but actually she came in for a consult. She's not a patient. So in sitting in on the consult, and she felt very, very... she's discouraged because this is a terrible, terrible thing, this burning bladder. But here's the thing, your bladder, of course, is the organ that's holding your urine. And, actually, in the old days in functional medicine, there was a lot of talk about utilizing your own urine for some of the therapies. Now, it's not something I ever subscribed to, but I had several patients from Germany who did. They would use their own urine in their own care. Now, that being said, but when the urine is sitting in your bladder, and people in healthcare are really used to this. We hardly ever take bathroom breaks. When we're on the floors, when we're out doing what we're doing, you tend to hold your urine more than, let's say, other folks, more than our patients, let's say.
That's not good, is it?
Not good, no. So one of the things that happens is when the urine is setting in your bladder for a long period of time, it may be exposed to toxins. For this reason, the bladder is coated with a very special coating. And the protective coating is made up with something called GAGs, G-A-G-S, GAGs. It's funny, but it really stands for glycosaminoglycogens or glycans.
I'm glad you pronounced that.
Yeah, yeah. And interestingly enough, we're familiar with this because we use those in several of our IV treatments. In fact, it's glucosamine, chondroitin, and hyaluronic acid. And they're used to protect your joints and ligaments and tears. They also protect your bladder. And I'm going to tell you, that's one of the reasons why I love the hydration therapy, because it's a way to help protect the bladder, because it does so by forming a thickening or a mucus coat that becomes a shield. So if this protective shield is damaged, what do you think happens? The bladder triggers an inflammatory response from cytokines and histamine that irritate and start the whole process. So it feels like your bladder is on fire. And you know how many women have this problem? Many. And you know what most of their GYNs and urologists tell them? There's nothing they can do for it. And that I hear a lot. What I want to say is you can repair these gags. And one of the things that you can do is you can take some natural substances to do so. And there are many, as I said, hyaluronic acid, chondroitin, and glucosamine. And actually, there's an actual study that shows that they use this by delivering it directly into the bladder by a catheterization. Well, that's a little extreme, but some people have needed to do this. But again, we deliver these by IV treatments. But we're also able to use quercetin. Quercetin, which is an extract, it's a very powerful anti-inflammatory that we extract from the skin around onion. Rutin is another one, and actually rutin is used many, many times because it stops swelling, and it's used in cosmetology a lot. So there are many other things women can do to help this, or men if they have this problem, and I just wanted to put it out that you can calm and soothe your own bladder if you take the time to look for these particular products. So I gave the woman this kind of information, and I told her, you know, if you feel like you can do that at a good health store, go ahead out. I gave her a couple brands that we would use, and hopefully she's doing that. And if she's listening, I hope she's doing okay.
Okay, so this is something you can buy in the health food store.
You can, but you got to get good quality products, and I would recommend a couple of things that were doctor formulated. And
it's not the same, though, as if she would have come in.
No, absolutely not. But I understand that some people have an aversion to utilizing hydration therapy.
Okay. Let's talk about, you have had a week.
Oh, my goodness.
You have had a week. I mean, this is a case where you had a patient, and I understand you uncovered Morphin's disease?
Morphans, yes.
What is
Morphin is a genetic disease, okay? Now, I'm not sure he has it, and I won't be sure until I get back the blood work, which is a genetic... Listen, I'm known as the DNA doc. So when I looked at this patient, and he was tall, he was lanky, he had a wingspan. By that I mean I made him put out his arms. I brought the doctors in, and I said, look at this, will you? I said, what do you think? I said to Dr. Pat. I said, don't you think this guy is a Morphin's candidate? She goes, you know what, Dr. Molly, I think you might be right. I said, well, I'm going to find out because I'm sending out for the genetic marker. And that, of course, can be done. I'm sending that out to a traditional laboratory that we all use. It's going to take a few weeks to get back. But the point is, he came into me with symptoms that were sort of obscure. He felt like his knees were knocking and clicking, and that's because ligaments were involved. And so I started putting all these puzzle pieces together along with how he looked. And I said, this guy, I bet, has Morphans. Now, in doing that, of course, I'm not just looking at his joints, man. He can have all kinds of vascular problems, aortic problems, cardiac problems. Then I got a little history about his uncle who passed away at 52 or something from an unknown cardiac event. And I started looking at all of this. So we, of course, treated his knees with some regenerative medicine, and more in the way of anti-inflammatories and that kind of thing. But I let him leave with prescriptions from our doctor to get what? Cardiac evaluation, to get Doppler studies, and to look beyond just why he came into me. That's why I think it's important.
And what's the prognosis, I guess.
Well, the point is you can live with this for quite a while, but you must make sure you get to a place that can manage it. And one of the places that does this is the Cleveland Clinic. And believe it or not, they're 3.5 to 4 hours away from that. That's how they travel to me from Ohio. And what we're going to do is we're going to compile all the information. I've already made a call out there. They have a Morphans clinic. And I'm going to get this patient over, assuming that the blood work and the Dopplers and all of this stuff comes back, showing that he does have the genetic propensity for this. We're going to get him there. We'll follow up, and we'll continue to follow him. My docs will continue to follow him through the clinic, through the localized area. And I feel sort of badly because I can't believe that his primary never thought about this.
Well, how many times have you heard that before?
Many, John.
Yes.
Too many to count. Yeah.
How many treatments do you think he'll need to
think
make a dent in this?
Well, I think he certainly spent the week with us, but I think the real key here is let's get the information. And the reason why I'm talking about this is to show that although we are a functional medical clinic, we are a functional medical hydration clinic, we know that sometimes you need conventional. And when you need conventional, like with cancer, when you need conventional, we're going to send you to a place to get it done.
Okay, we are coming up on our final break of the morning. 855-839-1210 is the number here. And again, it's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. 855-839-1210 is the number here in the studio. If you have a medical challenge or you just have a question for Dr. Molly, now's the time to do it. We have time for one or two more quick calls here. Feel free to do that, 855-839-1210. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We both return. More Health Watch after these words. We are back here on Health Watch, and again, operators will be standing by at Innovative Medical Associates, and they'll be there not only right now, but of course, after we leave you at 9 o'clock, they'll be there all day. 856-489-0505 is their number. 856-489-0505. If you want more information on Innovative Medical Associates, they'll be happy to do that for you. Any questions, they'll be happy to answer that. But most importantly, you want to set up that initial consultation with Dr. Molly Fantasia, and it is complimentary, and it's about 15 minutes or so, although we've never had a 15-minute consultation. So that's another story. 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. I want to remind you also, if you missed any of this morning's show, you can hear it again this afternoon from 4 until 5. It's our Health Watch replay every Sunday afternoon from 4 until 5 right here on Talk Radio 1210 WPHT. Dr. Molly, we ought to have a glossary of terms that we should print out so people can follow along, because invariably we always have a new word or phrase. This one is called ITP.
Right, idiopathic thrombocytopenia. So it's defined as a clinical syndrome where we have a severe decrease in the number of platelets in the body, and some of the clinical things that we look at for a patient is like bruising and extra bruising, superficial bleeding under the skin. And I'm not talking like with fragility under the skin from age related. I'm saying, of course, we're running the platelet count and we see that it's much lower. Excessive bleeding from your mouth and gums, urine, and also some heavy menstrual flows in females. What's interesting is this, we believe, although there's no known cause in conventional world, we believe that this is an immune system issue, where the body starts destroying our own platelets from the bloodstream and the bone marrow. And in children, there has been studies showing that this disease actually attacks after viral infections. So I'm finding it interesting, post-COVID. And I'm seeing some of my post-COVID patients seeing a reduction in their platelet counts. Not severe, but still there. Do we have a caller?
Yeah, we have a call. We'll pick that up in a moment. Okay. John is in Mount Laurel. Good morning, John.
Hi,
You're
John.
on Health Watch with Dr. Molly.
Good morning, Dr. Molly.
How are you, John? Good.
I'm doing pretty good, believe it or not.
Oh, good,
yeah,
good.
I got defibros. Now, you hit me with the defibros the last 2 weeks.
Yeah, D-ribose, yes.
I'm feeling really the last couple of days a lot better.
Yes.
So what I'm calling about is I hear you constantly on the show and people in the clinic talking about how long do I have to go? How many times do I have to sit in the chair? Well, you know, when you get sick, you don't get sick today. You get sick year after year. It continues to get a little worse, month after month. How do people think that it's going to go away in 2-3 treatments? I don't get it.
That is a good one.
John, because you're smarter than the average bear, man. Come on. People just want quick answers, and unfortunately,
what I'm saying is the treatments. You know, I hadn't been to the doctor for 4 years, and then I had to go get that X-ray. And
that's right.
And what they've done to me in the last 3 weeks, 4 weeks is just unreal. I even got a kidney infection. From the medication, they had to cut me down on that.
Right.
But if you can do the vitamins and you can do the natural foods and products and watch what you eat and sit in that chair, I think myself, I'm there every week for going on 5 years now.
Oh, John, and we love you.
It helps. It helps. I love you too, but I love you because you're helping me.
Thank God.
Yeah, that's right.
Thank God.
You know, I mean, it's the truth. Well, I just want to let them know. I just hear this all the time. Oh, how many times you got to go? You got to go.
Thanks, John. You're a great guy. Thank you. Thank you. He's talking about the D-ribose for the sugar, for it's a cardiac sugar. When I talked about the cardiac, I said that's only one thing, clearing out the calcifications, but you need to feed the particular organ. That's something we do for a lot of our patients. But getting back to this ITP, one of the things I want to talk about is that, again, I'm looking at the viral infection, so I'm thinking I'm going to see more of this. But anyway, the use of natural substances for this, we use things that papaya might be something I want to put the patients on, because why? It has E, it has C, that possesses the antibacterial and the antioxidant property, which regulates healthy digestion. On the other thing, we might want to put them on enzymatics, which I talk about all the time, right? Enzymes, we put you on that. We're going to put high amounts of B vitamins, A and E and C, and we're also going to use in the IV iron, calcium, and magnesium. Also, John, I've used aloe vera. As you know, I use a particular product that I tell people to get. So it's not just the hydration, but some of the things we want you to do in your lifestyle. I use extract of beetroot, and one of the things that does is it actually has a particular constituent in it that dilates the blood vessels, and it really helps the production of red blood cells. And by the way, this we use NAD for in the IV. You've heard me talk about that numerous times.
Quite well.
And finally, we will use one of my favorite herbs, ashwagandha. And ashwagandha has really been used in Ayurvedic medicine for years and years and years. And I had a wonderful medical director who was quite enthralled with ashwagandha, and as a result, I'm also a big believer in ashwagandha for all kinds of things, including our depression, etc. One of the other things we do is we look at omega-3s in this protocol. So it's an interesting protocol. The patient just started, and I'm going to find this interesting. And they did have some type of viral infection. They're not saying it was COVID.
Speaking of ashwagandha, can you give us a brief? What does it do?
We can help. It can help.
I heard you say depression.
It can help
That's one
maintain
thing.
physical and mental health. It really does. And it's been around for thousands of years. It's used, again, in Ayurvedic medicine, and it's readily available. I would tell people to look for a very good brand, and, we have that in our facility.
We have a call. Let's get her quickly, Jim. CJ in where's she? King of Prussia. CJ, good morning. You're
Hi,
on Health
CJ.
Watch with Dr. Molly.
Hi. The question I have for you is about inflammation in the body. My C-reactive protein is off the chart, but everything else is normal. And I've had a problem with synovitis in my shoulder, and then now I've got the thing going down both your legs. Sciatica.
Sciatica. Yeah. Inflammation. Now, you're saying this is just your C-reactive protein. What about your cardiac C-reactive protein? Was that normal?
Geez, I don't know if that was even tested. I just know about the one result, so that I couldn't answer.
Okay, well, you know what? You definitely are a great candidate for hydration therapy. I know we can get those inflammation markers back down. And I'll tell you something, CJ. I actually have laboratory results to show you that from our patients. Now, the question is, are you taking anti-inflammatories now, orally, I hope?
Well, I take vitamin C, B, magnesium, a multivitamin.
Good.
But nothing beyond that, really.
Well, you got to start looking at curcumin. You got to look at a whole bunch. You should come in and just have the consult if you'd like. But you really need to think about the hydration therapy as well, because I can get this down probably in as little as 10 weeks, and you'll be feeling a whole lot better. God bless you. Also have some homeopathics extracts that will help.
CJ.
Thank you, CJ.
Thanks
God
for the
bless
call.
you. God bless you.
Thanks for the call. Real quick, we've got about a minute. Phil in, where is Phil? Bucks County. Phil is in Bucks County.
Hi, Phil.
Yes, I had a question about chemical sensitivity, electro sensitivity. Are there biomarker tests for disease or inflammation to treat that?
Well, there are biomarker tests to look at inflammation. If you're asking me, is there an electromagnetic test for that? I actually can't answer that, but I can tell you that if your inflammation markers are up, you ought to look at anti-inflammatories all the way around, as well as detox if you think you've been exposed to this. So I would look at your conventional blood work, and I also would look at some non-conventional blood work to check this out. Have you been exposed to mold as well? Do you know, sir?
No. I get a bad reaction. I get a bad reaction to a diesel perfume.
Oh my God! Yeah. You really, it would still be interesting to test for mold spores. It really would. I'll tell you, there are several tests out there that we could do. God bless you, sir.
Yeah, I was.
Phil,
I've already been tested for a mold.
Okay.
Phil, thanks for the call. We
bless
appreciate it.
That's an interesting call.
And that's going to put the wraps on another edition of Health Watch. Don't forget, if you want to reach Dr. Molly during the week, 856-489-0505, 856-489-0505. You can call right now. You can call after 9 o'clock, or you can call tomorrow. But make the call, 856-489-0505. At least have that initial consultation, which is complimentary. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, we repeat it this afternoon, 4 to 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, Catherine, and Donna, and of course there's Joanne and fabulous Fran and delightful Dee, and our nursing assistants Sandra and Karen Kathy. I'm your host, John DeMasi. Thanks for listening. We'll do it all over again next Sunday, 8 till 9. Health Watch, Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.